Hello, everyone. Thanks for the opportunity to present this case with all of you. So, just married. That's the start of the story here. It's the story of a newlywed couple who spent their honeymoon in South America. And they're back in Switzerland, which is nice. Not South America, but nice. And that's the life that's waiting for them. Hiking around, picnic outdoors, winter, lakes and mountains, of course, in Switzerland. Some nice pit stop with cheese, and then aging in sunny and warm Lugano. So that was their view when they arrived in Lugano after their honeymoon, but there's a problem. The bride cannot see. So this is actually the story of a 39-year-old Argentinian lady who attended the eye A&E complaining of one-day history of bilateral blurred vision. Now, upon further questioning, she says that 2 weeks prior, she had sort of a flu, and in the past 4 or 5 days, she's having a headache, every now and then vomit after eating, and photophobia. Her history is otherwise not very exciting, unremarkable ocular history, fit and well up until then. Social history, babysitter, smoker, nothing interesting in her family history. And this is the examination, so there's something really wrong going on with both eyes, so right more than left. IOP seems to be okay, anterior segments wide and quiet. Now let's have a look at the back of the eye. We would normally do that with a slit lamp in A&E, but I did something a little bit more sonographical for you. So this is the right eye. I'm gonna zoom in. There's plenty of stuff going on here. I can't even start naming one of the findings because there's too many. This is the left eye. I'm gonna zoom in. And my first question for you is a lot on differential. What do we do now? If you could choose one single test, one, just one. I know we're all multimodal nowadays, but just one.
Somebody from the audience? This may be simpler than you think. Blood pressure. We heard blood pressure. What do you think? Is that what you're looking for?
More suggestions.
More suggestions. Sorry, it wasn't that simple. HIV.
Okay. Well, I thought, what if this was an official bet and we had our speakers and delegates and, of course, the chairs. Now, probably they would like a nice OCT, fluorescein angiogram that never hurts, blood test, blood pressure check. Yes, audience, yes, that was a good idea. Now, this is the OCT. Do you still want that blood pressure check?
Yes, we hear it. There's several yes.
Okay, there's no way of making you change your mind. I'll go ahead. So this is the multicolor, which I think in this case, I mean, it's usually used for MACTEL, but it's nice because it shows how, with the green wavelength, the fluid is actually all around the macula. But you can see that it's actually pretty much everywhere. And the choroid, it's also a little bit wavy. There's some exudation, which extends far beyond the fovea. So autofluorescence doesn't add much. And the spectralis is having a very hard time segmenting the optic disc OCT because of the swelling. So you guys were right. That was a good idea, and this is the answer. So pressure is high. My question for you is this just a case of malignant hypertension?
So somebody in the audience shouted out pregnancy.
She's not pregnant, but that was a good idea.
Did she swim in?
Nope.
So, you can get, this accelerated hypertension can cause diffuse change, but accelerated hypertension can be secondary to inflammatory diseases that cause renal disease. You've got the multiple continental spots, inflammation, the choroid, and the retina. So hypertension could be part of the manifestation, but you need to look at why she's so hypertensive, which may be adding to the phenotype.
Yeah, Prof, as usual, very thorough. and right. Well, the second question is, yeah, probably it is a retinal presentation of hypertension. Would you do something about the eye? Of course, we need some more investigation. We will call the proper doctors to help. But would you do something for the eyes in the meantime, or no?
So the question was, the comment was, how do we explain the jumpy, bumpy? Do expand.
Jumpy, pumpy aspect of choroid. So I will ask something about choroid also. Because it's very regular.
So you're saying lumpy, bumpy, when you think of lumpy, bumpy, you think of things like VKH, posterior scleritis, or infiltrative disorders, but you can get that just from the other conditions we've mentioned as well. It's not particularly seasick, but I think your point is well made.
Still, the question is pending. Would you do something about the eyes, or would you just leave it? It did look bad.
You can give anti-VEGF.
Anti-VEGF?
In one eye.
In one eye? Okay.
We've seen it work.
Now, what we decided to do was to do nothing and hand over the case to the medics, and hopefully they would crack the case for us. Remember, this is a young lady with no history of hypertension. So first thing, full blood count, not right. So anemic, and she's got these weird, messy blood cells, schistocytes all around. The kidneys are down, completely down. Acute kidney injury, stage 3. Look at the VEGF rate, very, very low.
Could you have some
Lungs.
kind of infection? Could you have an infection that also affects the kidney?
You could.
I asked about the swimming, something that swims around in sweet water. That you can get it from rats.
That would be a good idea, yeah, but no. And,
Gabriella never gives
hang on.
anything away. Well, keeps us drawing us in.
And the lungs are not happy. The heart is a little bit larger. There's this effusion pretty much everywhere. The kidney is big, but the liver is even bigger. And what?
There's somebody, sorry? Von Hippel-Lindau, somebody suggests.
Sorry, I didn't get that.
Von Hippel-Lindau.
Von Hippel, VHL.
No, but in the differential.
Thank you.
Now, the medics were struggling to understand what was going on. So they were like, let's look at the bone marrow, let's get some tissue from the liver, let's get some tissue from the kidney, let's see what's going on. And interestingly, what they found, which is very rare, especially in this age group, is a light chain deposition disease with an initial myeloma with a translocation, allowing quite selective treatment with chemotherapy. So that was quite a shock, and this patient was enjoying her honeymoon with that. But if we think of light chain deposition disease in the eyes, there's not much that we know, but the reports that have been published from 2013, 2016, they all look for like vitelliform light presentations, serous detachments, this hyperreflectivity of the choroid, especially on the inner side. But our presentation was probably actually confused by the hypertensive retinopathy. So how did it go? Raise your hand, please do it. Participate, audience. If you think this story has a good ending. Quite an optimistic audience. Okay, you're right, yeah. So you can see that 6 weeks later, things are actually going really, really well. Vision is improving, it's not great, but it's good. And you can see that the autofluorescence is cleaner. The fluorescein angiogram, we did it to look for ischemia. There was not actually interesting. The disc is still a little bit leaky. On the left eye, pretty much the same picture. You can see that actually the picture resolves pretty quickly in the eye. The OCT flattened very nicely and very quickly. If you think of the baseline, which looked horrible, that's quite a good outcome. And we saw the patient 2 days ago, which is pretty recent, and she's now able to see 0.8, which is impressive. She's feeling really, really well, and her OCT is nearly back to normal. So happy ending at last, and thank you very much.
Thank you. So how do you think, what is the pathogenesis? What happened?
Well, the thing is, it all started with the chains, then the chains affected the kidneys caused the hypertension caused the retinopathy, and probably that's how they're all connected.
So it's quite a complex picture because myeloma causes hyperviscosity and you have undiagnosed myeloma. Light chains, we presented a case at the EURETINA online case conference, bind to Bruch's membrane and are hydrophobic, but the fact when controlling the blood pressure it resolved means that you probably don't have much light chain deposits so far. And the light chains cause the cardiomegaly and the kidney problem. So the usual treatment then is immunosuppression plus or minus stem cells, but some of them recur, and they look at the Kaplan-Lambda ratio as your endpoint for treatment. So I hope they're going to do well, but the case I presented did terribly. And,
I know.
but so far, yours is doing incredibly well.
Indeed, I was
Yeah.
shocked, honestly, in a nice way.
Yeah, fantastic, wonderful. I thought, I wasn't quite sure where you were going with Newlywed in Lugano, but I was.
I needed a good start.
Yeah, so excellent start.
Come
Wonderful
to Lugano,
stuff.
it's nice. Okay.
Thank you.
Thank you very much. Very interesting. And so we're going to move on. We're going to keep you a bit later than planned, but we're going to move on.